Assalamu alaikum friends, welcome to my channel MBBS and BDS lectures. Today our topic is related to general surgery hypercalcemia. Before going to explanation, if you want to watch the same lecture in Urdu Hindi, I already upload the same lecture in Urdu Hindi on my YouTube channel. Go and watch that video. But if you want to watch in English language, then this video is for you. Now today our topic hypercalcemia. Hyper mean increase, calcemia mean calcium mean calcium, mia mean blood mean in our blood serum there will be increased concentration of calcium. Now in today's topic we will study definition, causes, pathophysiology, clinical feature, investigation and management. First we start from definition. How we define hypercalcemia? A serum calcium level greater than 11 milligram per deciliter is called hypercalcemia. This is the definition of hypercalcemia. Now come to the normal range. The normal range of calcium in our serum is in milligram per deciliter is from 9 to 11 milligram per deciliter. But in milli equivalent per liter, the range from 4.5 to 5.5 milli equivalent per liter. Now, if the level of calcium in serum less than 9 milligram per deciliter, it will be called hypocalcemia. But if the level of calcium in serum is greater than from 11 milligram per deciliter is called hypercalcemia. A serum calcium level greater than 11 milligram per deciliter is called hypercalcemia. If we define in milli equivalent per liter, then a serum calcium level greater than 5.5 milli equivalent per liter is called hypercalcemia. This is the definition and normal range of hypercalcemia in milligram per deciliter and also in milli equivalent per liter. Now come to causes. There are 4 causes of hypercalcemia. Number 1 cause is increased bone resorption. If our bone resorption increase, for example in hyperparathyroidism. In hyperparathyroidism, when parathyroid hormone is production become more, in result there will be increased bone resorption because increased parathyroid hormone act on bone and they resorb the bone, and due to this resorption the calcium from bone move toward blood, and in blood the serum calcium level will be increased. In the result there will be hypercalcemia. Second cause is increased GI absorption of calcium into blood. If from gastrointestinal tract the calcium absorption into blood is increased, again there will be hypercalcemia. For example, excess calcium intake such as milk and calcium supplement. If we increase the calcium intake, like we increase the intake of milk, we increase the intake of calcium supplement orally, in the result there will be more absorption of calcium from gastrointestinal tract GIT into blood, in the result there will be hypercalcemia. The third cause is decreased output. If the excretion of calcium from our body become decreased, mean decrease output, such as in renal failure and in thiazide diuretics. In renal failure, the calcium output from our body will be decreased. In the result there will be calcium accumulated in blood serum. In the result there will be hypercalcemia. Second is thiazide diuretics. Thiazide diuretics remove the more fluid but less calcium from our body. In the result there will be hypercalcemia. The fourth cause is increased vitamin D. If in our body vitamin D concentration increase, vitamin D level increase, again vitamin D accumulate more calcium in our serum, there will be hypercalcemia. Now there are four causes. Number one, increased bone resorption. Number two, increased GI absorption of calcium into blood. Number three, decreased output. And number four, increased vitamin D. These are the four causes of hypercalcemia. Now come to the pathophysiology. In pathophysiology, we remember three sentences. Number one, we remember three things. Number one, hypercalcemia inhibit depolarization of nerve and muscle. Hypercalcemia inhibit depolarization of nerve and muscle. In result, there will be, when inhibit depolarization of muscle, in result there will be muscle weakness. Muscle will be weak. Second, when inhibit depolarization of nerve, in result there will be neurological symptoms such as depression, psychosis. This is the first thing. The second is calcium. In hypercalcemia, calcium accumulated in kidney. When calcium accumulated in kidney, there will be kidney stone. The third thing is hypercalcemia cause shortening of QT interval of ECG, because in heart there is calcium channel, and hypercalcemia act on this channel and cause shortening of QT interval of ECG. In the result, there will be cardiac arrhythmias. These are the three things. Number one, in pathophysiology, we should remember three things. Number one, inhibit depolarization of nerve and muscle. In the result, there will be muscle weak. And number two, neurological symptoms. The second thing, calcium accumulated in kidney. In the result, there will be kidney stone. The third thing is it causes shortening of QT interval of ECG. In the result, there will be cardiac arrhythmias. This is the pathophysiology. Now come to clinical features. There are 11 clinical features of hypercalcemia. Number one, fatigue. Number two, loss of appetite. Number three, constipation. Why constipation? Because due to muscle weakness, because hypercalcemia decrease the motility of GIT, and the result there will be constipation. The fourth is lethargy. The fifth is thirst, and number six is bone pain. Why bone pain? Because due to increased bone resorption in hyperparathyroidism, when there is increased bone resorption, due to resorption there will be bone pain. Seventh is kidney stone. Why there is kidney stone? Because calcium accumulated in kidney, in result there will be kidney stone. And number 8 is hypertension. Why hypertension? Because in our blood vessel there is calcium channel, and in hypercalcemia, when calcium move inward vessel, they cause the contraction of vessel, and the result there will be hypertension. Number 9, depression. Number 10, psychosis. Why depression and psychosis? Due to neurological symptoms, because hypercalcemia inhibits the depolarization of nerve. And 11th clinical feature is muscle weakness. Why muscle weakness? Due to inhibit depolarization of muscle. In result, there will be muscle weakness. This is the clinical feature of hypercalcemia, which is 11 clinical feature. Number 1, fatigue. Number 2, loss of appetite. Number 3, constipation. Number 4, lethargy. Number 5, thirst. Number 6, bone pain. Number 7, kidney stone. Number 8, hypertension. Number 9, depression. Number 10, psychosis. And number 11, muscle weakness. Now we will study investigation and then management. Now investigation. In investigation, number 1, we do blood serum level. There are 4 investigations. The first investigation is blood serum level. When we do blood serum level of patient, the result will be high calcium level in hypercalcemia. Second investigation is urea and electrolyte. When we do urea and electrolyte level of hypercalcemia patient, there will be high calcium level. The third investigation we do parathyroid hormone level, and the fourth investigation is vitamin D level. These are the 4 investigation we do in hypercalcemia. Number 1, blood serum level. Number 2, urea and electrolyte. Number 3, parathyroid hormone level. And number 4, vitamin D level. Now come to the management. In management, we give 3 things to patient. Number 1, give fluids to patient. When we give fluid to hypercalcemia patient, due to fluid diluting effect, calcium level will be low. Due to fluid diluting effect, the calcium level of patient will be low, mean from high to low, mean calcium level will be normal. Second, we give loop diuretic to patient. When we give loop diuretics to patient, the loop diuretics remove in order to remove more calcium. It remove more calcium from our serum, from our body. In the result, there will be normal calcium level. The third, we give bisphosphonate to patient. When we give bisphosphonate to patient, the bisphosphonate reduce bone resorption. When it reduce bone resorption, there will be less calcium move to blood. In the result, there will be serum calcium level will be normal. And management, we give 3 things. Number 1, give fluid to patient. Number 2, give loop diuretics. And number 3, give bisphosphonate to patient. This is the simple management of hypercalcemia. Now today our topic is complete. We studied hypercalcemia definition, causes, clinical feature, pathophysiology, investigation, management. Now our topic is complete. If you like my video, press the like button and share this video with your friends. If you new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon to open the all notification in order to you receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.